Hi, everybody. Good evening. I am Dr. Christine Anderson. I am a chiropractor in Los Angeles, and welcome to my YouTube show. So, tonight we're going to be talking about Arvigo techniques of Maya abdominal massage. And this is a really great way to help support so many of our systems, including our reproductive system, our digestive system. So let's dive right in. So the Arvigo Maya technique was developed by Dr. Rosita Arvigo, a napropath, which is an offshoot of chiropractic where they work more with soft tissue. And she went down to Belize to learn about different herbs in the rainforest and ended up apprenticing under a Maya healer, a shaman, Don Eligio Ponte, and she studied with him for 12 years. Pretty incredible. And she learned about the Maya medicine and spiritual healing and also traditional Maya abdominal massage. And then she applied her knowledge and experience as a napropath to include the work on the back of the body that she added to enhance the effects of the abdominal massage. So from her website, the Arvigo Techniques of Maya Abdominal Massage Therapy helps to restore the body to its natural balance by correcting the position of the organs that have shifted and restrict the flow of blood, lymph, nerve, and qi. So that is what this is all about. And my story with this all began about 17 years ago, or give or take, right? When a patient with a prolapsed uterus after her second child started receiving my abdominal massage, and she was getting adjustments and I was having her invert, but she was driving about 1.5 hours each way to go to Riverside, and if you know where that is in Los Angeles, it's probably more like 2 hours now. And she was getting the Maya abdominal massage, and it was helping with her prolapsed uterus. And I said to her, I'm like, why are you going so far? There's nowhere closer that you can get this done. And she's like, no. And I thought, wow, that's pretty incredible, especially for a place like Los Angeles. So she held a self-care class, and I went to it, and there were a couple of other people there, and I was hooked and decided that there was a need for me to actually learn this technique because it was going to be a benefit for my patients. And so I had the pleasure of studying the Arvigo techniques of Maya abdominal massage with Rosita, and I did my professional training in the rainforest in Belize. So pretty cool. So let's go here. I'm having fun with this new format, so I hope you enjoy it as well. So I'm going to, so anyway, a few weeks ago, we had the pleasure, my daughter and I, of interviewing Rosita on our podcast, Your Baby's Brilliant Brain. And it was really great to reconnect with her. And I will, I'm going to put the link to the podcast in the description for you. So what is the Arvigo Techniques of Maya abdominal massage? It's a non-invasive external massage technique that helps to encourage internal pelvic organs into proper position, as well as improving the blood flow to the abdominal and pelvic organs for optimal health and well-being. It also helps to release stress and emotions that are often stored in the solar plexus and abdomen. This massage is effective for both men and women, although it's primarily women I work with, unless they are trying to get pregnant and their spouse wants to come in, or I have a patient who is male coming in. But primarily I'm dealing with women. So why is the alignment of the reproductive organs so important? Well, when the uterus is out of place, the flow of blood, lymph, and nerve impulses are blocked. This can cause the uterus, the fallopian tubes, and the ovaries to become twisted or torqued, affecting their function. This may create a blockage that causes a collection of blood in the uterus that would normally be released during menstruation. This pooling of blood can cause cramping and possibly even abnormal growth in the uterus. And the torquing of the reproductive organs may also impede the ability of fertilization to take place and affect fertility. So malposition of the uterus and ovaries can also affect the hormonal feedback system between the organs in the pelvic region, the reproductive organs, and the brain, which controls everything, including the menstrual cycle and then any subsequent pregnancy. Tightness of the diaphragm can impede the flow of blood into the abdominal and pelvic cavity for oxygen and nutrients, as well as the removal of toxins through the venous lymph system. And then this can affect the proper functioning of all the organ systems, including the digestive system, the liver, the kidneys, the pancreas, the spleen, in addition to the reproductive organs. So let's go back to the slide, and I do not know what happened here. My slides. Okay. Technical difficulties. Let me take that off for a second and come back here and just slide it back in again. Oh, good. All right. You know, technology, it's great when it works. All right, so let's take a little bit. Well, there's Rosita in the rainforest with her plants and herbs, having a big smile there. There she is with Don Eligio Ponti, and you know, they had a really, really close relationship. He was very reticent to teach all he knew to a gringa, but she convinced him that she would stay around and help with the people of Belize because all the young kids didn't want to learn about being a shaman. You know, they thought it was hokey, it's old-fashioned, right? So he was happy to help her with her training, and she did stay in Belize and help the people. So it's pretty incredible. There's a lot of things that are going on there that you could hear on the podcast. Okay, so here we have a picture of the uterus, the fallopian tubes, the ovaries. You can see some developing follicles, vagina, cervix, and then you see this big, it almost looks like a bat wing. It's the white color broad ligament. And this ligament, it's perfectly described, the broad ligament, because what it does is it spans over in front and in back of the uterus, enveloping the fallopian tubes and the ovaries, and connects the uterus to the inside of the pelvis. And this is why pelvic alignment is so important, because otherwise there's going to be twisting and torquing of the uterus. So let's go to the next slide. And this is what we can see here. So this is a top-down view we're looking at, all right? It's as if you were looking down through your pelvis, if you're a female. So you can see the uterus there in the reddish color, and the fallopian tubes that are off to the side, and the ovaries. And that kind of bright white color is what they are showing there as the broad ligament, which is attaching to the inner part of the pelvis. And then there's a couple of other ligaments we're going to talk a little bit more about in a second when we talk about pregnancy. So this shows a little bit of anatomy as far as where things are located. The yellow structure there is the bladder. The uterus is in dark blue. The vagina is in green. The rectum is in the back, the red color. And keep this in mind, because look at the positioning of the uterus this is a side view, by the way, as if we just came right down and sawed us in half, because this is looking at positioning of the uterus. And so you can see what happens if maybe the uterus is flexed forward at that top left and putting pressure on the bladder. Or if you go to the upper right, the uterus leaning back against the rectum, that can create issues with the bowels. And then on the bottom left, we've got a uterus that's just tipped forward, which is also called anteroverted. The leaning back is retroverted. And this anteroverted positioning, you can see how it changes where the opening of the cervix is. And then at the bottom right, we're looking at a retroflexion of the uterus flexed back and pushing on the rectum. So we're going to come back to this slide, and let me get it out of here. So let's talk a little bit about what this can help with, the Maya abdominal massage. It can help with painful or irregular menses, or no menstruation at all, abnormal bleeding, varicose veins, endometriosis, uterine polyps and fibroids, painful intercourse, PMS, uterine and pelvic adhesions, frequent or chronic urination problems, ovarian cyst, vaginitis, menopause, irritable bowel syndrome, IBS, or other digestive issues, chronic constipation, organ prolapse, pregnancy, and fertility. And for males, it can also help with prostate issues, erectile dysfunction, low testosterone, digestive disorders, and like I said, fertility, and that's related to low testosterone or issues with the sperm. So let's talk a little bit about fertility. As you saw there, a woman's uterus is held into place inside her pelvis with ligaments. Those uterine ligaments can become weak and overstretched, causing the uterus to fall downward or side to side. And I didn't have the picture of the side to side, but it can tip right or left. This can happen with things like falls, sports injuries, accidents, and even pregnancy, as we're going to see in a moment, as things get really stretched out with each pregnancy. And another way that this can happen is by doing high impact types of sports like running or high impact aerobics, those type of things where you have a lot of bouncing up and down. It's like tension wires that keep getting stretched and pulled. Sometimes they give away. So the uterus can then get stuck in that tilted position or off to a place, to one side or the other. So part of what the Maya abdominal massage protocol is to assess and work on helping to align the pelvis using gentle mobilization techniques. And this is done on the back, and this is what Rosita brought to the traditional Maya healing. So this is important because the uterus, fallopian tubes, and the ovaries are encased in that broad ligament, remember the picture, which anchors the structures to the internal wall of the ilium, which is the part of the hip bone. So like when you put your hands on your hips, that inner part is where it attaches, and that's called the ilium. When the pelvic bones are out of alignment, this is also going to contribute to the malpositioning of the reproductive system. And this is one of the reasons why chiropractic care also can positively affect the reproductive system and help with fertility. So this is something I love doing, is helping my patients basically get pregnant, even though it's not me, but it's really great. So I even had a patient come out of menopause twice with donor eggs and IVF to get pregnant twice. She had 2 children, and she came regularly for her Maya abdominal massage and also did it at home. So when women are trying to actively get pregnant, I'm going to do the lower abdominal massage, and they're going to do their self-care only after menses is finished, and when they're ovulating, then they stop, because then there's a chance that they might be pregnant. So they would have to stop unless they menstruated again. Upper abdominal work, however, can be done at any time, and I'm going to talk about that. So let's talk a little bit about pregnancy. This is done after the first trimester. Rosita and the Mayans like to just let everything settle down and come together and not disrupt the process too much. So again, this can be helpful for all those reasons listed above as far as what this can help with. In addition to that, optimal blood flow into the pelvic cavity is going to ensure that the baby is receiving proper nutrition for their growth and development. This is because the blood flow going into the pelvis is going to be optimized, and therefore the blood flow to the baby through the placenta will be optimized. And this can even help with things like IUGR, or intrauterine growth restriction or retardation. So that's sometimes what happens, where the nutrition isn't getting to the baby, they're not growing, and then they want to take the baby out early. So if we can help with that, even better for that baby to stay inside. So optimal uterine position also helps to allow for optimal space for the baby to move, and this is needed for their development and getting them into that head down position. So let's go back to our diagrams. And here you see a pregnant belly. Again, this is a cross section. It's like we've just divided ourselves in two. And you can see that the uterus, which is covered in that broad ligament, it's stretching. And you've got the front ligament called the round ligament, and you've got the back ligament called the uterosacral ligament. And what that does is it keeps the uterus pretty much straight up and down so it doesn't tilt too far forward and too far back. And those ligaments are in play even without pregnancy. And this is sometimes these are the ligaments that get a little tired and a little weak and let that uterus shift too far forward or too far back. And then this is actually a slide or diagram, I should say, that I use talking about baby positioning with chiropractic, because I also do a technique in my practice called Webster technique, which helps with this alignment of the pelvis and specifically the sacrum, that triangle shaped bone in the back. But this is why too my abdominal massage works so well with what I do, because of these alignment principles. But you can see there, when the pelvis is torqued and twisted, it affects what's going on with the ligaments, and then it can affect what happens with that baby to be able to get into that head down position. So the optimal positioning is that bottom right, the LOA, which is left occiput anterior. And when there's a pelvis lined up, the baby can be comfortable, but when there's misalignments, the baby can't get into that head down position comfortably. And so they get into other positions like a transverse, or it might be a right occiput posterior, or even a breech position. And again, when I'm working either with chiropractic or with my abdominal massage, I'm not trying to move the baby. I'm trying to optimize mom's pelvic outlet and get that lined up so that the uterus can be in the proper position. All right, so what to expect from a session? Oh, hang on, before I do that, let's go into the diaphragm, because this is another aspect that's super important. And you can see that sort of brown, coppery colored material there. That is the diaphragm. And most people don't realize this encircles the entire rib cage. So you've got coverage in the front, and it creates a dome, and then it connects in the back at your ribs and over the vertebra. And I want to show you this next picture because this is really important. This is as if someone were standing at our feet and looking up. So we're looking underneath the rib cage and seeing that dome shape of the diaphragm and the vessels that are running through it. So that red vessel is the abdominal aorta. That's the vessel bringing oxygen and nutrients into our abdominal cavity and our pelvic cavity. Then we've got the blue vessel there, which is the vena cava. That's our venous system bringing everything from the body up to be eliminated. And then we've got the esophagus in kind of the center there. It's sort of a pink color. And this is why sometimes people get heartburn or whatnot, because there's a lot of tension in that diaphragm and it can just squeeze down on those vessels. So this is really great, and that upper abdominal work can be done at any point in the cycle. So it can really help take the stress off the vascular system and even where the emotions are, because we can store emotions in the solar plexus and in the abdominal muscles and in the diaphragm. All right, let's come back here. All right, so what to expect in a session? Well, for the first 2 sessions, I spend more time, and because I'm showing how to do the self-care on top of also doing the abdominal massage. So you're going to stay clothed. I recommend having loose pants with an elastic or a drawstring. And in my office, I do the abdominal massage on something called a biomat, which is filled with crystals. And this is going to create an infrared deep healing aspect to the treatment. So it's really great. Before I even get started, however, I'm going to do a comprehensive review of your personal history and what your needs are and what your goals are. Then I will do the lower and upper abdominal massage with deeper work into the areas of the solar plexus and abdomen that tend to hold stress. I'm going to do the back work, including the lower back, the sacrum, the pelvic bones, and the coccyx. I am going to use firm strokes, but it's not painful. It's to your tolerance and comfort level. I'm going to show you how to do your self-care technique on that first visit. And on the second visit, when you come in, I'm going to review your self-care technique. And this is why I recommend patients committing to at least 2 sessions, so I can do that so that you're not going forward too far and having some technique issues that then becomes a bad habit, right? We want this to work. Now, sometimes there can be an emotional release when I'm working, and that's great because emotions are stored in our tissues, anything that gets blocked. And I just have you observe that emotion, no judgment, let it move through. I hold your space, and then when you're ready, we move on. So after the massage, many people feel like they can breathe deeper. They feel a level of stress going down, very relaxed. Generally, the response is great. So it really depends how often to come in, what your goals are. If you are trying to get pregnant, it may be more often. If you are having health issues, it may be more often. If it's just for regular upkeep, it might be once a month or quarterly. As long as you're doing your self-care, the 2 work together, because I'm doing some things that you won't be doing, especially the back work and the deeper abdominal work. So the frequency is going to be decided on your history, on what I find on the exam, and your health goals, and we talk about this. All right, contraindications. No lower abdominal work when you are actively menstruating and during the first trimester of pregnancy. So we do not do that. You can always do the upper part. We don't do any lower abdominal work 6 weeks postpartum or 8 weeks after any abdominal surgery. When you're taking pain meds, this is contraindicated because you can't have that feedback system. A no-no for the lower abdominal if you have an IUD or an active infection or cancer, especially in the pelvic area, or if you're undergoing chemotherapy. These are times that we don't want to do the abdominal massage. And then if someone has a hiatal hernia, which is where they have sort of an outpouching in the solar plexus area, we can still do the massage, but we just go a little bit gentler. So If you would like to schedule an appointment with me, please request an appointment through my website. Let me know you want to do the Arvigo techniques of Maya abdominal massage. I will put that link in the description. And many people actually choose to see me for the reason that I am a doctor of chiropractic. This affords me an advantage with all my clinical training as well as my 30 years of experience. If you are not in Los Angeles, however, and you need to find a practitioner, I will put the link to the Arvigo website in the description so you can find somebody there. So I hope this was really helpful. Give me a like. If you found this helpful, please share it. Please subscribe so you don't miss any of my episodes. And I will also put the links to the other episodes I've done on fertility. All right, everybody, have a great week, and I will see you next Tuesday, same time, same place.